Hello, today we're going to talk about menopause and pelvic health. So, what the two most common things I see in my menopausal women is pelvic pain and incontinence. And so they both have sort of two pathways to help them. Um, so, number one, pelvic pain. The number one thing I tell people is if you're postmenopausal, you've been through menopause, what happens is your body stops producing estrogen and our vaginal tissues, and now we're learning our cells throughout our body have estrogen receptors in them. But what happens, I'm going to show you a model. So, sort of, this is the layer of the muscles, but the skin, the labia, the lips, these tissues have vaginal estrogen receptors in them. And once your body stops producing estrogen, these outer tissues become thin and dry. And then our mucosal linings, the vagina, becomes dry. So when people have pelvic pain, number one, I always ask, are you on vaginal estrogen? I know for a long time these studies were misinterpreted. Everyone was scared of estrogen. It gives you breast cancer. I'm not a medical doctor, so you have to talk to your medical doctor about this. The risk is low. It's not nothing, but it's pretty low. And you have to talk to your doctor about this. But the other thing is vaginal estrogen. It usually comes in a cream. It can come in a pill, a suppository, or a ring. That is different than menopausal hormone therapy that's systemic. So vaginal estrogen therapy is generally regarded as very, very safe. And I learned from one of my followers, I think on Facebook, told me in Europe, it's just over the counter. If you're over the age of 50, you can just get this at the drugstore. But in the US, it's prescription and you have to get it from your doctor. So that is localized. It just stays in this area and it doesn't affect the rest of your body. So talk to your doctor if you have concerns, but ask them about vaginal estrogen. And I did a video a while ago, I'll link it in the notes, about vaginal estrogen versus vaginal moisturizers. And in the US, and I'm assuming worldwide, there's no regulation on this. Vaginal moisturizers you could just buy over the counter on the internet from your neighbor down the street. Literally I see people oh, I just made this vaginal moisturizer, which personally I'm not putting anything on my vagina that hasn't been tested and regulated, but you do you. I'm not your doctor. I'm just person on the internet. Okay, so let me tell you the difference. Vaginal estrogen, it has estrogen in it that goes to our cells, that thickens these tissues, that lubricates them, that helps. Vaginal moisturizers are like a chapstick. They just sort of put moisture on the surface. So there's a big, big difference. And I don't know, to me it's wild, people who are I don't want big pharma, but I will buy this from my neighbor down the street who made it in her home kitchen. I don't know. That's just wild to me. But again, you do whatever you want for your body. I'm not in charge of your body. But again, have a talk with your provider. So number one, if people have pelvic pain, always am asking if they're on vaginal estrogen. I highly, highly recommend it. I see the difference in my patients, okay? I'm not Joe Schmo down the street. I see vaginas every day. But then the other thing is, a lot of times people are sex is painful. So most of my patients whose problem is pelvic pain, that usually for them means pain with sex or with intercourse. And so that's again the vaginal estrogen, used lube. But the other thing that we treat in pelvic floor therapy is maybe the muscles are tight. So normally with arousal, the vagina expands, it makes room. But if the muscles are tight, they don't necessarily expand. They should, but if they're abnormally tight and tense, we got to work on it. So let me show you two tools that I like to use for these patients. So obviously in the clinic, we do things hands-on, but these are 2 tools I have them use at home. So this is called a pelvic wand. Man, I always love when I match my tools. And what this is kind of like you can self-massage the muscles with this wand. So you can kind of find the tight points and work on them. The other tool that I like to use is called vaginal dilator. So these usually come in a set of different sizes, and what you do is these also get inserted, and you just leave it in, and it's like general stretching of the vaginal tissues and the pelvic floor muscles. So really, I would recommend try to see a pelvic floor therapist, and they can assess you, and then you can figure out which tool is best for you. So the dilators are just for like if everything's tight, if like you can't have any insertion into your vagina, probably this. If it's more like certain points are tight, we go with this one. So both are good, but different reasons. I will link these also below. These are both products from Intimate Rose, and I'll link to their website. I use these with all my patients. I think they're great. So that's pelvic pain, vaginal estrogen, pelvic floor therapy, dilators, or pelvic wand. The other main thing that I see from women who are menopausal, after menopause, is incontinence. And these patients are probably the one type of patient that they need Kegels. So if you've followed me or watched my other stuff, I'm usually like, Kegels are not the only thing. But for some of these women, Kegels are it. So what happens as we age, we lose muscle mass, like sometimes up to 3 to 5% a year. So you need to strength train. If you're a woman, do it for your vaginal health too. It's different in men because testosterone doesn't stop producing after a while. They have testosterone for life. Like maybe it's less as they get older, but it's different than women where we stop producing those hormones. And women have a little bit of testosterone too, and that also can be lower after menopause. So you need to strength train. And I would say even a lot of my patients in the clinic who are menopausal, like they work out with a trainer and they strength train, they go to the gym, but the vaginal tissues also get weaker. So that is probably one population that I'm like, do Kegels, you need to do Kegels, And sometimes I'll give them other exercises, but I'm like, if you're lifting weights and you're working out in the gym, then your other muscles should be getting worked out. So your pelvic floor muscles should contract and they should work with every time you do exercise and movement, but sometimes we got to train a little bit more. So sometimes gym exercise is not enough, and we need to do Kegels. We need to specifically strengthen the pelvic floor muscles. So that is one population I would say, like, sometimes you just got to do Kegels. But incontinence can be a mixed bag. If you have bladder leakage with like coughing, sneezing, sometimes there's tightness that we got to work on first before strengthening. Sometimes it's habits. I'm not going on a regular basis. I'm going too often. I have triggers like I see the toilet or I get home from work. I mean, I'm coming home and like the sight of getting home, right? So I address these all in my bladder course. It's like a very comprehensive course. I'll link the free preview course you can take and learn a couple things. So kind of like my patients in the clinic, if we rule out like, all the habits and tightness, and then sometimes they just need strengthening. Sort of like I just can't make it to the bathroom, right? If it's like, okay, I'm going on a regular basis, I'm spreading out my water intake, I'm not waiting too long. If we optimize all those things, then Kegels. So those are the two things that I see most commonly in menopause.